These are hard conversations. I've blown them many times myself. I've not known what to do. And with this study coming out from the Mass General where the patients had seen a palliative care physician, I realized that the gain they'd gotten was that really they'd seen 6 people who knew how to, that's the staff at the Mass General for palliative care, that they'd seen one of these 6 people who knew how to talk to them about the end of life. And so what I did was I went to those doctors and just said, I'm really bad at this. If you had to make a little list for me of what it is that I should talk about with people facing these problems, what would you put on that list? One of the doctors that I spoke to was a palliative care physician at the Dana-Farber Cancer Institute named Susan Block. And Susan encapsulated it, I thought, the best for me, at least in a way that I could use. She said that there were 4 things that she has as a little mental list in her head that she wants to talk about with a patient who's terminally ill. Number 1, do they know their prognosis? Number 2, what are their fears about what is to come? Number 3, what are their goals? What would they like to do as time runs short? And 4th, what are the trade-offs they're willing to make? How much suffering are they willing to go through for the sake of the possibility of added time? That list was really interesting to me. It was not a list asking, do you want a ventilator or do you not want a ventilator as you come to the end? Do you want your heart shocked? Do you not want your heart shocked? Her point was, if you tell me the answers to those questions, I can make a recommendation to you that says, you would not want this toward the end if these are your goals. Our misconception is that the conversation is about hard choices. Really, it's a conversation about asking people about what they want to look forward to as time runs short and what they fear the most. And the second misconception is that that arriving at what we want at the end is a kind of epiphany. Sign here, do you want hospice, do you not want hospice? It's not an epiphany, it's a process. It's a series of conversations and ups and downs as we go through a very hard series of sequence of things that happen to you as you become ill and have things come to an end.